Here we go.
All right.
There.
There's the local. Okay, you can read the top variables. Over surveying. We got issues in the bars. They're not enforcing that, and we've had several accidents as a direct consequence of over serving. I've attached the responsible beverage server training. Oh, did you put that on there, Kelly?
I didn't put it on there, but I can pull that up, and that's just a PDF, so that should pull up pretty quickly.
Yeah, that's just for anybody that wants to see our ordinance tribal.
Now, is this an ordinance? Oh no, this is in effect August of 2020. Okay. So
Yeah.
alcohol beverage server training. Perfect.
Yeah, it looks good on paper, but they gotta enforce it,
Sure.
And so there's no one. I don't know. I go to the casino now and then, and yeah, I don't gamble. I go to donate, but anyway, I noticed they got a bar there, and it's not enforced.
Mm-hmm.
I'm not. They fired the gal that was training, and I'm not sure. I haven't found out if they rehired that position for the server training. Anyway, the law requires that anybody serving alcohol has to have this training.
Mm-hmm.
So that's part of my efforts here, along with ID checking. I don't go in the bar, but I'm pretty sure, based on just that casino, which is a real busy spot, just looking around, and I've asked a few of the customers if they were 21, and they all say yes, but of course I didn't check them or anything, but that's something we're looking at, and then the bottom line there under local conditions, we're working media campaigns to impact this, because there's, it's just, that's the culture, man. Drinking, over serving, binge drinking, and that goes down to the activities, the media campaigns, data collection ongoing, and alternative activities, of course, cultural stuff. I got a really good response for my college survey into the fiscal year. I got 81 responses, which was up about 400% or 300 at least. An advocacy and coalition development to try to get the right people in there, the people, the advocates that want to do something, Some of these coalitions in the past here, they're just a bunch of just BS session, and a lot of talk and no action. You gotta be careful who you get involved with, because some just talk. Others will put it into action. Okay, get the next page, will you, Kelly? That's the strategic plan. So that shows some of our data in there, and that's about all I can think of. Anybody have any questions?
Nope, looks good. Yeah, let us know what you find out with that requirement for server training and stuff, or if you need any assistance with that.
Well, it's on the books, and the council passed it, of course, but enforcing it is another issue.
Yeah.
Do you know offhand, Dave, what the consequence of violating this?
Well, they
ordinance is?
should be in there in the ordinance. There's a fine and
Okay.
see, and then we were talking about going to Terrell. That's where, you know, any business on the coming on the tribe has to have a license. So we're talking about impacting that some way to take their Terrell license, and they wouldn't do business if they don't comply with this server training ordinance, each bar. So I need manpower and coalition help, other help, you know, to get into that, and that's in the works.
Yep.
Sounds good, Dave.
Thank you.
Thank you, Dave. All right, I got roulettes finally pulled up here now. Go ahead, Sarah. Oh, you're muted.
Sorry about that.
That's okay.
The first couple slides just talk about what our plan is, and we are concentrating mostly on the underage drinking. Again, it is given by adults, a lot of parties in garages, closets and things like that. So, or the parents giving it to them or just drinking at the homes. We have had a few places card, and there was one on Rolette County that the sheriff had talked to Barb, and a fake ID was used. So that person was not served, and that's a win for us. Jen
Which
and
slide
I will
did you
be
want
doing,
me to be on, Sarah?
what you can flip through, probably down to probably slide 8 is even fine.
Oh, okay. Okay.
Because with the first ones are just talking about what the problem is and that, and going forward.
Okay.
So just kind of
Sorry. Thank you.
cut it short and stuff. So working on like social host law and implementation, you can start on there. Callie, sorry.
There we go.
So one of the things we've been doing is a lot of the parents lead information given out. The Dunsey School, the St. John's School, they always have big family nights at the end of the year. We were also out with the RV in, I think, May, end of May, first part of June. The Dunsey, they had a grand opening for their new fire station. So Trinity even brought in their helicopter, and other agencies throughout Rolette County were there. And we were there with prevention information and also with Tetera and naloxone. Were also available. In May, we were at the St. Kateri Hospital in Rolla. We did the hidden in plain sight with our mock-up bedroom and information for parents. Also, some of the medical providers, even at the hospital, just showing even, I do the tobacco stuff too. So a lot of the different types of vapes, but also how they can hide alcohol, drugs, and some of their items that look like everyday items in bedrooms. So that was a big hit that day. Continuing on.
Oh, oh no. Okay, let me try this. I tried to open the next slideshow and now it's freezing up on me. Sorry, guys. Oh, come on. Yeah, I might just have to have you guys try to walk you guys through sharing your screen because this is not working with my computer for some reason.
I can go ahead and
Yeah,
mine
you can do that. I'm sorry. I would like to be able to just pull everybody's up, but and if I try to load more than one at a time, this is what happens. So sorry, everyone. Normally I'm pretty good with technology, but it just doesn't want to work with me today.
Another thing that helps, Callie, is have them downloaded on your computer. so that you're not trying to pull them off of the Z drive.
Oh,
And
does
that will
does
really
that
speed
make
them
a
up.
difference?
Huge difference. Yep.
Okay, I did not know that. Okay, I'll put them on my desktop next time then, and
You can even try that
unless
now if you
maybe
want
opening
to slide
them
them over.
if I put them onto our Teams like SharePoint. Do you
I
think
would
that
keep
would
everything
you
on your
keep
computer
everything on
just
my
for these. Yep.
desktop? Okay,
And you can even
I
slide them
will
over
do
right now and
that.
see if it does it. But
Okay. What a pain.
Can you guys see anything?
Yep,
Yep,
you're
it's
up.
loading.
Yeah, you're up and running. I can see it.
Up and good?
Yep.
So to some of the prevention campaign messages that we use, Facebook is the way that we use. So the parents lead. The calendars are always nice. We usually get those out to parents in bags that we give out at family nights. We have a couple bulletin boards in our office, and Jen, one of the workers here, did Be Kind to Yourself, some mental health things to give yourself some mental health breaks, and what are some ways that you could do that. During Mental Health Awareness Month and National Prevention Week, we put out a kind of a schedule of different things that they could do. And that's the week that we did the Hidden in Plain Sight at St. Kateri's, and posted one day some mental health breaks that people could do. And we did have people that did respond and say, hey, these were kind of neat to do. Did a couple of them throughout the day. That's nice to hear. Facebook posts proms. We had proms in April and in May. So they had bags with prevention information, parents lead. Those were given out. The playing cards. And those are just a couple messages that were given to Roulette and the Dunseith schools. Graduation is also another time. So congratulations to our 5 area high schools information. And then I did a video during graduation weekend and Memorial Day weekend. Time to celebrate, but do it again, promoting not giving alcohol to underage drinkers. We did have in June on the 27th, we had a summer safety event. So we had a bike rodeo, we had car seat checkups, and bags also filled with parent lead information. Some of the door prizes we had bikes donated by our Kiwanis Club, and then also another private donor, and some of the winners that we had of those bikes. So driving through the cones, we had law enforcement, we had the ambulance, we had fire, so some safety there. And they got to meet the jog from Rolette County Sheriff's Office. Chase is new. And another thing is we have a forensic scanner, and we will be rolling out our first forensic scanner in Rolette County in July to one of our businesses here in Rolla. And then Jen and I will be doing responsible beverage server training August 14th when that's online. That's what I have.
Perfect. Thank you, Sarah.
Thank you.
Okay. I do have sergeants pulled up. I believe they were one of the grantees that said they weren't able to attend, so I can just go over theirs real quick since they emailed it to me ahead of time. Okay, looks like Vanessa and her team started off with one ID scanner in their grocery store for a year. So that'll be the first implementation of the forensic ID scanners. And there you can see it in this photo. Oh, it looks like their grocery store in Foreman has kind of their liquor section right there. So
Good use of the signage. You see that? We scan for fake IDs. I like that.
yeah, that works really well. Prevention efforts, looks like they are utilizing the ND tip line says here they played radio ads during girls and boys state beat basketball tournaments, had a press release in the local paper, shared it on social media, hung flyers, created stickers, and placed them on the Narcan kits. Posted in the local newsletter and the Living Local app. They've so far received 1 tip. Looks like the high schools, maybe, I'm not sure what SCSO is offhand. I'm assuming one of their school programs, providing DARE and Keeping It Real to 5th grade students. And then if you guys haven't seen this commercial, I'll drop the link in the chat. They did a really awesome job with this commercial.
SCSO stands for their sheriff's office.
Oh, okay.
Yep.
Got it. Sargent County Sheriff's Office. Okay. Too many acronyms, you guys.
I figured with that DARE program that they want you to implement that with using the Sheriff's Department of Law Enforcement. So
Sure. Okay.
So it's good to see you guys are doing a lot of those curriculums because it seems to be the Keeping It Real one. I've seen that in a couple presentations now. So.
All right, and then their goals: educating youth and adults on negative effects of the brain from alcohol use, continuing to promote ND tip, expanding where you're promoting materials. Looks like they want to go towards Instagram, Pandora, and Spotify. ID scanners, they're going to have their ID scanner at the Sargent County Fair. Training all volunteers for the beer garden and how to use the ID scanner. They'll have a banner and a flag being displayed during the county fair. Prevention videos being broadcasted on Beck TV and will air during both North Dakota Rodeo Association rodeos during the fair. And finally, ultimate goal is working on passing a social host ordinance in the county. So, perfect. Okay. And then Tom's little trick worked like a charm, so I can pull up Southwesterns right away.
It took me a long time to figure that out. I didn't notice it until you opened your folder.
That's an easy enough fix. I just didn't know that would have made that big of a difference. So, learning things every day. All right, Karen, you ready?
Ready. Okay, so we're Southwestern District Health Unit, and we cover actually 8 counties as far as the health unit, but our focus is on the Dickinson area for this grant. And we are focusing on underage drinking. And the intervening variable is our high social access and then the community norms that there's just really not a view that it's a concern. You can go to the next one. And the local conditions are youth are obtaining alcohol from adult and family members, and then belief that alcohol is acceptable for teenagers. That hasn't changed. And then, of course, some of the things we're doing, compliance checks. Jennifer is our compliance guru. She handles that end of it. And then I do the forensic scanners, and we have 2 forensic scanners out in the community now with 1 more ready to go out. And we did send letters out to all the Dickinson liquor license holders regarding the responsible beverage server training that's available through the North Dakota Safety Council, and we let them know we have wristbands and ID scanners, and sent them a photo of the forensic and information about the forensic scanners, how quick they are, and what they're all checking. And then our media campaigns, we do the weather app, which has really been a good thing for us. Because it seems to be utilized a lot during the winter and the summer. You know, the summer we have our tornado and weather watch, and in the winter it's, you know, roads and those kinds of things with that. So that works out really well for us. We also do, you know, various social media. We have a public health newsletter, those kinds of things. Parents lead materials. Danielle is our guru with that. She does a wonderful job of getting materials distributed and getting posts put on various sites. And then we also have someone who contracts to do some of that posting on 3 different social media sites. And we've been doing some things where we actually we have a Spanish translator here. And so she was able to translate some of the parent lead materials into Spanish when we needed them in a pinch. But the state has been working on getting more of the parent lead materials into Spanish. And the reason we did that is because we had a health fair that was women empowering women, and it really kind of focused on our Hispanic culture, was a big part of that. And then we had, you know, a parent fair, and then we had a Heart River School Health Fair, and then we had the Kids Health and Safety Fair. So doing a lot of community events. And then we've been meeting with some of the schools regarding our regional event, and we're focusing kind of on middle school. Jennifer met with the health board and kind of shared with them the Not in My House, you know, campaign, and we're waiting for that new redo of it. And then the Not in My House stickers have gone to the Medora musical. They'll put them on popcorn bags there and that kind of thing for us. And then, of course, we're working with our youth commission. And they did an event. And if you want to go to the next slides, then we'll show pictures of kind of, this is kind of some of the parent lead things that we've gotten in Spanish and English. We did the one where we just actually put it on the back, and then our Kids Health and Safety Fair. You can go to the next one, that's fine. We had kind of it was a zoo theme, and so they wanted a train, so we got a train or built a train for it. And so that's kind of just the booth setup, and that's a couple of our staff, Jennifer and that. And then this was kind of our message there, you know, because we work with Jennifer and Danielle who do the tobacco part, so we did the alcohol, vapes, tobacco, and drugs in that kind of thing with the animals. And then the next one is the grease flyer, which is what the Youth Commission was working on to have an alcohol-free event. And they went through and did that, and we just kind of helped them with the posters, and they distributed it. And then that was kind of held the end of May, and they had a good turnout. Things went well. So we're looking forward to hoping that the next thing the Youth Commission wants to work on is a battle of the bands. So we'll see how that goes. So I think that's it. Any questions?
Awesome. Thank you, Karen.
You bet.
All right, I've got Spirit Lakes here up next.
Okay. Well, good morning. I'll just, okay.
Yep.
Okay, my problem is I'm working on the binge drinking, and some of the things that I've been doing is, you can go ahead and go to the next, is working with, well, I've had a tough time trying to work with this, you know, current administration, trying to meet with them, getting us, you know, a stronger alcohol ordinance in place. But, you know, I got to just keep trying on that. But what I am working on is working on the non-alcohol community areas, putting in signage. You could go ahead and go to the next. And some of the activities that I've been doing is like through social media, the community events, health fairs, through email and other local programs. And I've been doing the Speak Volumes campaign and through those areas. And some of the new signage, on the one on the left, the Look, Listen, Love, I had stickers made, and I put those on like water bottles just for, you know, have some of our information on there, contact information. And I had where it says, how does your drink add up? Those are actually posters that I had made up. And I'll be taking those to the casino once I get to get the, what do you call the, I can't even think at this moment. the ID scanners. I'm sorry. And on the bottom, that's just right now, that's kind of in the works. The no drugs, no alcohol, and no smoking allowed on premises. Those are the signs that I'm going to add a few more logos on there. Right now, I just have tribal health, but I'm going to add a few more logos on there. And those are going to go in our playground areas. And those are the ones that I'm going to have an event tied into those. So in each district, when I have those put up, I'm going to have an event tied into each district. So then, I have that sign and have the event tied into that signage there. You can go ahead and go to the next. And then, that's just the example of, some of the activities that I go to would be like health fairs. And then when I set up the booths, like Elders Day Out, that kind of thing. And then some of the information that I put out from Parents Lead would be like the brochures, flyers, social media posts, the communication cards and posters. And that's all I have.
Very good. Hey,
Perfect.
did you get the scanner, Mardell, and your
No,
bag? Not yet?
not
Okay. They were shipped to you this week, so you should get them pretty soon.
yeah, so I can't really do anything, or once I get those, and then I'll kind of tie in some of that other stuff, as far as the campaign with the coasters and stuff, because I kind of wanted to do that all together once I go to the casino, because that's kind of one of the things that they had wanted was the ID scanner. And I thought at the same time I can kind of, kill two birds with one stone type of thing, where once I meet with them, I can bring all my materials up with me at the same time and talk about, the responsible beverage serving training and stuff like that. Because I know right now, I believe they're going through Ramsey County and want to talk to them about, if they would like to get a server training going and handle their in-house versus utilizing the training, outside.
Okay. Well, if you need any help, just let me know because I could help talk about the forensic scanners if needed, and even could bring some few IDs if they want to look at them. So just let me know.
Oh, all right.
Okay.
Perfect. Thanks, Mardell. All right, next up we have Tammy, Standing Rock. I don't have a copy of yours to pull up, I don't think.
Okay, that's fine. I have
Unless you emailed it to me in the last like 10 minutes. Oh yeah, sure enough you did. Okay. Oh, maybe not.
no.
Yep, I don't have a copy for you.
I didn't know we were supposed to have like a presentation. So I think I'm gonna start off with talking about our different roles. So I know that not one person does the same thing as grantees. So I do a lot of administration jobs, duties. So I know not I kind of know that nobody else does that. So I kind of want to talk about my role in as a coordinator for the Standing Rock Sioux Tribe also is that I'm responsible for the budgets and the contracts. So that means that when I receive them, I have to go through the process. So that process includes sending that contract to our attorney, getting that approval. Once that approval's done, that contract has to go through signed. Everybody has to sign it. Once it's signed, then it has to go to, first the contract has to, so the rough draft of the contract has to go through our HEW committee, which is our standing committee, health and welfare committee. education committee. It goes through there, has to get approved there. Once that contract is approved there, it goes through full tribal council. In that committee, I also have to talk about the 8% indirect, and that's an issue every year with because the state caps it at 8%. So that's a fight every year that I go to HEW. That contract goes through full tribal council approval. After that, I have to take the budget. The budget has to go through the same, our HEW. It doesn't just go through that one committee. It also now has to go through our judicial committee. So that takes all that time. Once it goes through our judicial committee, then it has to go through full tribal council committee. Okay, then I can start doing work. So that is not all of what I do. I do all my own travel. I do all my own everything. So ID scanner, we got it. Thanks, Tom. I'm so anxious. Contacted the casino. They want 2 more of them. And I'm like, hold on. Hold on. So the individual that I talked to hooked me up with a security director. So I'll currently be working with the security director, scheduling a time for Tom to come down and do the training. So in discussion with that, I threw in my 1 box Narcans for the SOAR grant. So once we're doing that, they want the Narcan, the 1 boxes. So we'll be doing all that. I use the 1 boxes, and I'm going to use it because I'm not crossing over, but to explain how I'm doing both of them. So I take the 1 boxes out to the county and distribute 4 of them. The county sheriff is standing there, you guys. So I have him pull the 1 box video down. I did training for like 6 people in 2 minutes. And I was like, oh my God. And then while I did the Narcan training, I said to our sheriff, I said, do you know that the state has been trying to get a hold of you because we have the 411 tip line? So it's really good to be able to have both. We will be introducing our primary prevention project to the Prairie Night staff also. So that's another big thing for Standing Rock. Another thing is I reached out to the individual that works on beverage server training, or the training that they have at Prairie Nights. He didn't get back to me. I noticed that there was a new training coming out that everybody has to get, the new curriculum. And so I reached out to them because the last training we were at, they were there and I didn't need to be there because they're already trained in it. So I mentioned to them that I could cover cost if they needed, but I'm waiting to hear back on that. We also are gonna launch our primary prevention project. Now we'll be serving over 300 participants, and it'll range from youth to elderly. So I'm kind of excited about that. I emailed our tax director on the increase of liquor tax. Also, I look back into my previous emails, and I emailed her back in November of 23 asking her the same thing and never got a follow through. So I'm gonna personally follow up with that face to face. I also got some really good news. We have our districts have TVs linked now, that we can link any virtual, any Zoom meetings, any team meetings. And so we're going to start doing a primary prevention scheduled days in each district. So we'll be recording our massage therapy, doing some self-care stuff, and then have a scheduled day that it would be shown in every district. So we're going to start working on some of that stuff. I also did we did women's and men's way. The Standing Rock Sioux Tribe and IHS worked together and did those this year. In both, we had 11 participants. It was awesome because I got to use our community readiness booklet, took it out, our primary prevention, both of them talked about, and people, the participants had there was so much conversation about all the drugs that the community readiness survey laid out, that there's a equal amount of percentage of drugs being used on Standing Rock, and people didn't realize that. They thought it was maybe just meth or alcohol, and when they looked at how it stretched out, there was so much conversation. We had like little breakouts, and you only have a little bit of time, and they would say, Tammy, you have to stop. You have to move. We have to move them on, because it was a really good conversation with them, individuals. Also, we do our annual events, the community fair, the career fair, the youth wellness day. We reached out, our CHR has a tribal health bus now, and they go out doing STD testings. So when they're going out, they're taking parents' lead information, they're taking all my information out to the communities. The powwows also, our CHRs in treatment will take all my prevention and all our SOAR information out. I think one of the biggest barriers for Standing Rock and for AOD is there's only me. There's only one person, and it's really hard to cover all of everything. Also, our primary prevention project will be working with our Standing Rock High School has a radio group of individuals that have a radio show. And so our primary prevention project will be working with them on self-care also. So that's going to be interesting. We have some pre and post surveys in there, and we have, so we'll have some, hopefully some positive outcomes coming out of Standing Rock. So I think that's all I have.
Awesome. Thank you, Tammy.
Yep.
All right. Steele County.
I'm just gonna share my screen.
Perfect.
Can you see that?
Yes.
Okay. So I know that we were supposed to only choose one variable, but I'm doing retail and social accessibility. Our focus, like kind of since summer started, since school got out, we've really been focusing on the forensic scanners. We got an extra one from Tom, thank you. And we've had it just at June. We were at 2 events, and we had over 700 scans, which for Steele County with only 1,200 people, that's a huge amount of scans for us to get. And something I put on here, we didn't detect any fake IDs. And I don't know if that's because we deterred people from using them, or if they were able to get it somewhere else. Like, that's kind of remains to be seen, but I'm hoping that they were a deterrent. The sheriff really thinks that it was a deterrent. And the bar owners, they also seem to think that it's a deterrent, because our sheriff has been really great about this. He takes them to different sites every week. So we have 2 scanners, and he's rotating them. So all of our bars in the county are getting the training on the scanners and able to use them. So I feel like people also aren't avoiding where we're putting the scanners because they don't know where they're going to be. So I'm lucky our sheriff's office has kind of run with the scanner side of it, so that I can work with our schools and then kind of the social aspect side of it. Some of our activities with like Parents Lead and other messaging. At one of our meetings, someone said that they put Parents Lead resources in all of their food pantry baskets, and I just thought that was a great idea. So we're actually going to start doing that too, which I'm really excited about because we actually have quite a few families come in here, and that's kind of, we always say that like the parents that we want to reach usually aren't the ones seeking out the information, and I think this is a way to kind of hit other populations. There's baseball tournaments. They're actually over in Trail County, but our Steele County kids go into Trail County to play sports. And so they needed someone to work concessions for the baseball tournament. And I was like, well, I'll work concessions if I can put public health stuff on the packages and everything. And they were like, okay, whatever, just whatever you need to do. I'm speaking with churches about getting a little blurb in their programs. Again, brain development stickers for the concession things at baseball. And the little clinic in our town, it's the only one in the county, and it's only open 3 hours a week. But for whatever reason, the Parents Lead like conversation starter card deck things like go like candy there. I don't know if it's because people are sitting there a little longer and they actually get to look at it, but that's been a good place for the Parents Lead stuff to kind of disappear and people take it. We have one billboard in Steele County at the fire station, and we do have a Parents Lead message on it. And then this was another idea from someone at our last meeting. They have a little county health corner in the paper. And I'm also speaking with them about that just because I think that's a really cool way to kind of keep all the residents up to what we're doing. Once we kind of get through, we have events like every weekend in the county right now. Once we get past that, we're going to do ND tip, continue our forensic ID scanner. We're going to do weekly Parents Lead materials for the school when school starts, stickers and coasters. Also, once the summer events are over, the sheriff's office has agreed to attend the Train the Trainer RBST training with us. So all of us will be able to train for RBST, which I'm very excited about. We're planning our regional event. We have a few, like I said, every weekend we've got something. And the other big highlight is Trail County. Deb has started a coalition, a substance abuse prevention coalition, and has been kind enough to include us in that. And I think that's really going to take off. There's a lot of people passionate about that and coming to those meetings regularly, and a lot of great connections are being made. And I think I'm really excited about that. And Deb's done a really great job with that. And then I just wanted to say thank you to everybody because I am alone out here. And so these are really beneficial for me to bounce ideas and learn, and it keeps me really motivated. So this is a great group, and I'm thankful for these meetings and all the knowledge people share.
Awesome. Thank you, Hannah. And I always like seeing, Deb and everybody working together in the different areas too, when it's needed, when it's super rural and everything. So that's great too. Karen did have a question in the chat for you, Hannah, if you have a sample or a picture of what those brain development stickers look like that you'd be willing to share.
Yeah, I'll send them out.
Yeah, I think that's a good idea.
Yep.
Perfect. All right. And Hank, I've got yours pulled up if you want me to share it for you. You're muted.
Oh, sorry. Thank you. Yeah, that'd be fine. What's easier?
Okay.
Is it easier that way?
I've already got it pulled up, so it worked.
Excellent.
Now that
Cool.
Tom's little trick worked, now I'm not having so many issues. So I've got it pulled up for you here.
Cool. Thank you. Well, good morning, everybody. Yep. No, just kind of going off what she just stated. Thank you all. This is a very, these are very informational and does definitely help have a visual. So so this is my presentation. Focuses on underage drinking. I don't officially have a logo yet, so I just been using that little. This is kind of my poster logo right now, sticker. So okay, intervening variables, social norms and access to alcohol play a huge role. Growing up on the reservation, we are constantly reminded of the stereotypes that plague our Native people. Home life and parents in active addiction can also play a huge role in normalizing underage drinking. For some of our families, alcohol is socially accepted and sometimes looked at as a rite of passage. Local conditions, we had a rise of minors in consumption in MHA Nation in 2023 with a total of 67. Social availability, youth obtaining alcohol from older family members or alcohol being easily accessible at social gatherings. Strategies, work with local law enforcement to implement continuing education through weekly evidence-based curriculums, promote parents lead and not in my house campaigns at community functions and presented in the schools, as well as on social media. And activities, meet with local retailers to implement ID scanners to curb the use of fake IDs. I have reached out to the casino, Mr. Tom, so as soon as I'm just waiting to get a official meeting time. So when I do, I'll let you know if that's something that you might be able to be part of, just so that we can try to set something up and some server training with them as well. Continue with social media campaigns, as well as utilizing local papers and message boards to promote underage drinking prevention. Continue working with stakeholders and our coalition groups and partner with MHA schools to continue presentations as well at and to continue our mentoring to at-risk youth. Short-term outcomes, shift perception of the youth as well as adults in the social norms are our norms for our communities, Education on the toll that alcohol has on the body to help youth make healthier choices for their body and minds. Intermediate outcomes, decrease fake IDs and curb access to alcohol and retailers selling to underage youth. Provide server training to curb overserving and create incentives for retailers upholding policies. Long-term outcomes, decrease the number of minors in consumption in 2024 by 30% and continue to monitor monthly surveys to grades 3 through 12. And this is kind of the activities area. This I just threw on some a lot of pictures. So this right here is the team that I go into the schools with. As you can see, I partner with our behavioral health from Elba Woods, and they are the opioid response program as well. And they also do suicide prevention. So we basically go in there and we just take turns doing each classroom, and then we'll take turns even sharing, the presentations if somebody's not there. But it's a really great way of doing this. The approach seems to work very well with the students. Instead of me going in there by myself every week, going in with a group of people, it kind of adds more energy to, it's more effective to the students. And here was, we did a presentation to our local elementary schools, had a teacher in service. So we were asked to come and provide presentation to them as well, which was very awesome. And that pictures me at our local radio station known as KMHA. They have a weekly open hour, so we can come in there and just give our updates every week or let them know of any community activities we might have. But they are huge supporters in our prevention efforts, and it's been really great to partner with them as well. And on the right, that was a career fair day at the end of school. So that's my beautiful canopy and my tables, and I usually have a nice throw for the table, but it was in the wash that day. But yeah, those are things that we that I get to do every week in all the schools. And here is just me in action with the high schoolers. I believe that's Partial High School. And then on the right is our youth group that I'm also a facilitator of. Our it's called NAFA, and I believe Tammy had mentioned it, but it stands for Native American Fatherhood and Families Association, and that training took place down in Arizona. But we meet with our group every other Wednesdays, and right now currently we have an incentive going with them We're doing we have a garden project here in the community. It's called the Seven Sisters Garden, and it's basically a big plot of land, and every program in MHA Nation is open to come in plant seeds. But for us, we're utilizing it as a protective factor, and also, adding cultural knowledge as well of cultural plants that we're planting and teaching the kids. And we also have incentives it's an 8-week program. Every new program we start is 8 weeks, but we just want that to have consistency with the students that show up. So currently we have 14 students that show up, and we have an incentive of Megaband wristbands right now. All right, yeah, next slide. Oh, and that's there's Miss Callie. Miss Callie, she showed up to my office, and we were having an elders bingo day that day, and she was kind enough to come and do some training with me for the Qualtrics. And then on the left, that's our team with the principal of Mandaree School, and on the right, that's the principal for Twin Butte School and one of our DEA agents. And that was at their 8th grade graduation, where I was honored to be asked to be a public speaker that day. So that was awesome. And we just recently had this. This was kind of my first opportunity to put together an event in collaboration with my point of contact team with Good Road. Man, it was a lot. I learned a lot going through this process. I guess just being a good speaker in general, I was kind of tasked with kind of spearheading this event. So I had four other team members in the Newtown area that I worked with. But on the right, you could see all these programs. These are all the awesome programs that we have within MHA Nation. Man, they came out to support. We had a really great day. And it was all geared to the youth, and we had the radio was there, councilmen were there. We had a lot of guest speakers, and a lot of kids showed up because a lot of kids are into basketball, volleyball, but some kids don't all play sports, so we had to have a few things there also. So we had some cornhole and some fishing, and we also did a color run and a diabetes walk. Our diabetes program sponsored our walk. We had our infant and toddler program come out, and they just recently purchased a snow cone and cotton candy machine. So that was a huge hit with the kids. Next slide. And this is a few pictures from that event as well. We also had we partnered with a local t-shirt company in Watford City. They did an amazing job on our t-shirts, and we put all, as you can see on the left there, they put all those same logos on the back. And that was really huge for people. Just a simple thing as having their logos made them feel more included. And that's what I stress unity. Anytime I talk on the reservation, I speak about unity, because in a way we're kind of segregated in our segments. And being is that I'm a MHA Nation grant, I'm able to go out to every single segment, which is so awesome, because I'm able to basically do things that nobody has really had the opportunity to do. And these are things that we can, keep doing as we go. So we're just kind of getting the momentum going right now. And that's just a preview of the t-shirts. And on the right, yesterday we had an awesome write-up in our local newspaper of our event, and they did interview us. So yeah, it was a pretty nice write-up for our event. So just trying to get my program out there, letting them know that MHA Nation does have an underage drinking program now. It's pretty awesome to see the support from our communities.
Awesome.
And that's all I have.
Great job, Hank. Dave asked in the chat if he could get a copy of your presentation.
Oh, absolutely.
Okay, perfect.
I'll send it over, Dave.
All righty. Thank you, Hank. All right, next up we have Deb Trail. And I don't have a copy of your slideshow, so you'll have to pull it up. Oh, you're muted. Deb, you're muted. You're muted. There we go.
Hi. Yeah, sorry, Callie, I did not send you anything. I
That's
only
okay.
made an outline this time and I was about to send it to you when I received the thing that the meeting was canceled.
Yeah, I'm
And
sorry about all that
no,
confusion.
I'm glad that I saw the email, albeit like 18 minutes later, but so yeah,
I was
I'm
trying
here.
to troubleshoot why it even happened in the first place, and yeah, so.
So, okay. So I have our area of focus is underage drinking, our intervening variables, our social availability and ease of obtaining, parental modeling and social norms. There is adult binge drinking is high, and understaffed law enforcement. Our local conditions are adult supply alcohol to minors. Fake IDs are being used to obtain alcohol, and the low number of minor in possession charges are due to shortage of law enforcement or, lack of them really enforcing the laws and it being rural. Sometimes it's hard to find the areas where they are consuming. So, overview our activities and successes since our last meeting. I've been focusing on improving a lot of our usage of social media and on our new website, which highlights both the parentlead.org and parentlead Facebook page, as well as I've been more active on our own Facebook page with a lot of Parents Lead information. And we've been seeing a consistent increase in the traffic with that, like even just our last month of stats on that page has gone up a lot. And based off of other suggestions just from last month's in-person meeting, I put together a packet for our local registered daycare facilities within Trail County. And I just have that packet here. I don't know if you can see it. Our first page has like a letter to the parents, and then it has QR codes for our website, which has the parents lead, and our Facebook page. And then we had a trail tracker activity for our residents. And then I just had, I had in here the 30-day Parents Lead Summer Challenge and the parent self-assessment and more Parents Lead information along with preventing underage drinking and then color pages that we got from our last thing. And so this was like 15 pages all in all. And as I was like collating them all individually, I realized if I ever do something like this again, I would create one document with it all and print it. That would have been much easier and much more less time consuming. So if anybody thinks about doing that, just put it all together as a one thing. But I delivered that to 11 different daycare centers within Trail County, and that was about 260 packets. And I got really good feedback from the daycare centers. And as, let's see, we did our second coalition meeting since our kickoff, and that was what Hannah had mentioned. And we're going to decide we're going to start meeting like every other month. And there we introduced our charter, the vision, mission, goals, and then we started our initial planning on our first collaborative event. We are going to have partnering with Safe Kids of Grand Forks. They're going to do a child care seat check and also give heat stroke information, like don't leave your pets or your kids in the car. They have this cool little thing that they can show you the difference of the outside temperature to how quickly the inside of the car gets. And we'll have the opportunity to have a drug take back event, and we're going to have a Parents Lead booth there. And then we possibly, I'm going to see if the Vision Zero lady could not attend our coalition meeting, but she will probably want to maybe have something there as well. And I really like the fact that we're partnering with other with other counties. We have someone that's been coming consistently to our, not only just our coalition meetings, but our coalition planning meetings. And he is going to help provide a law enforcement for the Take Back event that's going on there, because our law enforcement is so short-staffed. And then, of course, Hannah's been attending. And so, yeah, it's just great to have more feedback. I mean, in my little unit here, we only have 4 employees. So just having the resources of you all and knowing what everybody else is doing, it really helps with finding different ways to implement the program. And one of the other things we've been doing is we do have the local radio from KRJB. He comes by and he does like just little interviews. It's usually about monthly, but not always. And then that actually goes up on their website with a little tidbit. And so, and as Hannah mentioned, Brenda usually does like our little health unit or county health corner that comes out in the newspaper. Sometimes it's parent lead stuff, sometimes it's other stuff. So it just depends. And then we also have with KRJB, we have our weekly radio ads. And during the school year, we have advertising on the Your Live event. And that's when they view the school sports. And then there's like a video part ad that comes out there that we have the parent leads that are just available on the website. For other alternate activities, I finally heard back from the Delchar, the theater owner. We have the one theater in Trail County, Delchar, and last year they had free movies that were sponsored by certain other companies. They were just like matinees for kids. So I've been trying to get in touch with him about doing ones like later in the evenings for youth. And he's just a little overwhelmed right now because they're doing construction so he is really interested in picking up something in the fall. So hopefully that will happen. And then we're also planning, our regional event that we're going to do with other counties, hopefully doing responsible service training, and then having the pulse credits to increase participation from law enforcement, and have training on compliance checks and on walkthroughs, DUI checkpoints, forensic scanners. And Tom, we might look for you to help participate in that. So that's still kind of in the, and I think we're planning that in the early or late winter, early spring timeframe. And then as far as barriers, it has been slow progression of participation, but we are actually, with building the coalition, I think that's really working out well as far as creating those ties within the community. So I'm really optimistic that trend is going to increase. Another barrier is I am leaving my position because I'm moving out of state, but we did get another gentleman who starts next week. And so we're going to have a 2-week overlap. So I'm really looking forward into that, and I'm confident that he'll be able to pick up where I'm at, and it will continue to grow. And just the other thing, it's been hard to coordinate efforts with law enforcement because they are so short-staffed. I've been trying to get forensic scanner stats, but I don't know if I'm going to be able to get that before I leave, but I'll make sure that Chris has connections so that he can follow those. And, I have talked with them about the ND tips, and they are just at this time, they are like, no, don't do that to us right now. So I'm hoping that at some point that can be implemented as well. And once again, I really wanted to say, I'm sad to leave my position because I really feel like I'm finally at a point where I've reached a good stride. And really a lot of that is from you guys, because nobody was in my position before I started. So it was just kind of like, well, here are the grants. There you go. Read the grants and go. So I really appreciate all the support. You guys have just been totally awesome. And so I hope that you will be, I'm sure that you will be every bit as nice and helpful to Chris, who is my replacement. So I thank you so much.
Yeah, absolutely. And if you want to let him know too, Deb, I know you said there was a 2-week overlap, but I can always set up kind of a one-on-one with him to kind of get him caught up. That's kind of what I've done before in the past when we've had new staff come in, is I can just kind of run through the contract and the resource guide and just kind of get him caught up on things. Or if you want, I know you kind of have the opportunity to do that too, but if you need me to kind of step in and help onboard him, I'm more than happy to. But yes, we will miss you and we
Absolutely
wish you the
perfect,
best of
because I
luck.
know that you know so much more about the grant than I do. And, you know, just even if we do overlap and say like the same thing, it'll just like help reinforce it for him.
Sure.
Thank you so much.
Yeah, no problem. Well, yeah, good luck. You got a couple messages in the chat saying thank you for all your hard work and good luck on your next adventures. So we'll miss you. Alrighty. Do we have Miranda on with Upper Missouri? I don't know if I got an RSVP from her. If not, do we have Joelle with Walsh County? Maybe. Okay, if not,
Yes,
I can.
yes,
Oh,
I do.
you're there. Okay.
Sorry, I'm just trying to get my thing pulled up. So
You're good.
Mm-hmm.
Oh, Chelsea said Miranda's out of town. Okay. Oh, and I might have actually gotten that in an email. I'm so sorry. Yeah, I did get that in an email now that I think about it. Too many things bouncing around my brain. So no worries.
All right, everyone can see that?
Yes.
Yes. Okay. So, oops. We're Walsh County Health District. I help out with the grants. My name's Joelle, and then Alan also kind of does some of the administrative stuff on the grant. We're right up here in Walsh County, very, very small county, about 10,000-ish in population. Our priority substance is underage drinking, and then we chose high social access just because a lot of like law enforcement and kind of some of the perception data was showing that parents didn't think it was a big deal giving their children alcohol at home and or not monitoring their alcohol at home. That was kind of been seen in our county of the biggest problem with underage drinking, not so much like the fake ID aspect, more so happening at home and being condoned by parents and or older relatives or friends that are buying for them. Our county's really small, so a lot of times everyone knows everyone. So if an underage person walks into a bar, a lot of times there might be someone in there being like, I know who your parents are, I know how old you are, we're like, what are you doing here? So that's not as big of a thing. Some information dissemination. We do a lot of social media. We did some national prevention posts and do a lot of parents lead. We supported all of the proms in our county, so we did a lot of prom posts, tips around that time for parents and kids to stay safe. We've been having a really good relationship with our local radio station. So we've been doing a lot of radio ads, which has been really good with our county, especially during sporting tournaments, because a lot of people tune in during those times. We've also put in, like around graduation, we did messaging for underage drinking. Summerfest, which is basically a huge binge drinking event in our county. So we did some messaging around that. Also, underage drinking is kind of big. 4th of July, we did some messaging about monitoring alcohol for parents lead messaging, and then we're going to do some around Labor Day too. It seems like a lot of people go away to the lake around that time, and so maybe hearing some messaging leading up to that weekend about monitoring alcohol and underage drinking, all that good stuff. Then some more information dissemination. We have been providing a lot of supplies to the local libraries. She actually just reached out again to get some more parents lead activity books, which I finally have gotten some more in now. I had just given her my last ones the last round, so they're really good about giving out supplies to parents and kids and in our county. And then we also came up with these underage drinking prevention and parental education kind of brochures, double-sided. So I worked with the tobacco prevention specialist, and we created one side talking about vaping, and then the other side talking about underage drinking. And it's geared more towards parents about what they can do to help prevent underage drinking, monitoring alcohol, having conversations with your kids, kind of those parents lead promoted initiatives. And then we passed those out at the school carnival in Grafton that we had a booth at. And that's always well attended. I think this year was around 900 and some attendees, which is a really big event for our small county. So we hit a lot of families in that event. And then also, so Tri-Valley is another school in our county. It's like a upper valley, so kind of like a preschool, early childhood development kind of. And they do some summer programming for older kids too, but we were able to give brochures to them, and they're actually having an event coming up in August where they have a free meal, and they have families come out. So I think we're gonna set up there and kind of get some more information out that way. And then our Welsh County Substance Abuse Prevention Coalition is still going pretty strong. I've been meeting every other month in the summer months just because everyone's kind of busy going to the lake and vacations, and it's hard to get a lot of attendance in the summer sometimes. So the overarching goal, the environmental strategy, is still social host ordinance within Walsh County. And then we, have switched to every other month. And then in September, we're going to start to monthly again. And we have a lot of wide range of members, which is kind of nice, just all different walks of life and all different professions. We also met with some stakeholders at the Walsh County Mental Health meeting. They have kind of like an unofficial coalition that they've started up just the last few months where they've been meeting quarterly. So it's been really good to just talk to a lot of other professionals that way and network with a lot of the school social workers and get an idea of what kind of resources are in the county. So I've been learning a lot about the mental health resources as well, and kind of been networking a little bit to have people either join the coalition or kind of forming those partnerships. So building capacity, I attended a professional development webinar with Partnership to End Addiction and Not My Kid prevention webinar, and it was really good. If you guys don't know what Not My Kid, I'd go check out their website. They have some prevention things regarding substance abuse. The one that they talked about that I thought was interesting is promoting a third space, so to speak, in kids. So they found that kids who have a third safe space, so not just going home and not just at school, but having like an extracurricular or being involved in a group or having somewhere else besides school and home to go to, was a real protective factor when you were looking at prevention of drugs and alcohol. So I thought that was interesting. And then of course our Bismarck in-person trainings by Growth Partners. So that's my contact information. I think the one other thing I wanted to mention was if anyone has any information like how I know people had talked about sending out letters about their forensic ID scanners. If anyone wanted to share any of that with me, of what they exactly put in their letters or samples or any information or tips about approaching retailers, there hasn't, like when I try to approach retailers about, specifically we had a Summerfest event just recently that can be probably one of the more times there possibly could be more underage drinking, maybe fake IDs, because there's a lot of people from out of town and it's more street dance style. It's like kind of free for all. And then historically, they've been giving a lot of minors in consumption at these dances. But a lot of them don't want to use the forensic ID scanners. They want to use just the palm scanners because it takes too much time. So I did lend out some palm scanners for them to check, just the date on them, but it doesn't scan if they're, real or not. So I don't know if anyone has any tips or information they could share. Just shoot me an email or put your email in the comments and I'll connect with you because yeah, they kind of just don't want to use the forensic ones because they're too much of a hassle. So that's all I got.
Yeah, that's interesting. I haven't heard that before yet. So I haven't anyway. But yeah, even if you guys have sample letters, you want to send them to us too, that'd be great because then we can put them on the website. Because I know Karen said that she hands out a letter, and I think somebody else said they hand out letters. But yeah, we could, if you give it to us, we can post it on the website and let you guys know it's there. And yeah, I think that's a really good and valid like document to create. So
Deb asked in the
Hey,
chat real
Tom.
quick, what are palm scanners and how we get those. We don't actually promote the use of the palm scanners because they don't do the forensic, the full scan to detect if they're fake. Kind of like what Joelle said, they only just check the barcode or the date. And so they're really not ones that we promote using. I mean, you can get them on your own if you choose to. I think there's a few companies that make them, but I don't know. Tom can maybe expand on that a
yeah,
little
we
bit.
just can't support those with block grant funding. We can like because all they do is just the math on the ID and just on the information provided on the ID and the barcodes. And we know that the fake IDs are copying that barcode information. So they get about 5% of fake IDs that come through, so very low. But yeah, like you said, they're there to do the math on the ID. They will not fail a compliance check with them because compliance checks that the youth has to use their real ID. So it will help them, not fail a compliance check. But yeah, it's best to have them set up those forensic scanners. And what's really nice about those forensic scanners is you can get like an electric generator. They're like a little portable battery generator thingy, and that's all they need. They just need electricity. They don't need Wi-Fi. They don't need anything. It's just a little bit of electricity. So even an extension cord, and then tapped into the building. So yeah. So it's definitely something that we can do is help draft that letter to get some of that support from the retailers. So.
Or Tom, I just have a quick. Could
Go
you
ahead.
maybe put this like in some talking points on why the forensic scanners are better than just the palm reader scanners, and your explanation and data, so we just have this in talking points so that we can reiterate it to city council or officials and stuff?
Sure. And you know what, Chelsea, you guys had some really good talking points created a while back when you guys were implementing the policy for requirements for forensic scanners in your retailers. So I'll see if I have some copies of those, but I'm hoping you guys still have some of those. I remember there were some talking points you guys created when you were meeting with your city council and stuff. But yeah, for sure, we can do something like that.
We can come up with a document of talking points, and then we can also kind of use what you guys have done with those letters and create kind of a template and add that to our forensic ID scanner toolkit. So.
Yeah. Well, because like Watford has in their ordinance that they're required at all retailers. And so like now do we tell the retailers that, hey, you have to all buy 6 scanners now because it's in our city ordinance?
Yep. And that has been some of the questions, like how do you communicate with them now that it's like a requirement? And I was under the impression that law went away and then it just came back again. So yeah, we can definitely revisit that. I would like to learn more. But yeah, I know there are some talking points put together, and I'll see if I can find those, and we'll also use the letters that you guys have to compile some information.
Okay, we do have 3 more presentations to get through real quick. I know we only got about 5 minutes left, so we might go a little bit over. If anybody needs to jump off, that's fine. Next up we have Wells. Jordan.
Okay. Can you see my PowerPoint?
Yep.
Okay. So in the county, we have 1 sheriff, 3 deputies, and then 2 contracted fill-in deputies. Harvey PD, keep us in the news. They all resigned the end of June, so no police presence there. So, really hard to get anything established with the revolving door of law enforcement. I mean, Harvey especially is a revolving door, but even the sheriff's department, I mean, it was the sheriff and then just the 2 contracted part-time deputies for a really long time. So kind of back to square one with building relationships. Our focus is on high school students, mostly the high rate of alcohol use among students within the last 30 days, intervening variables, high social access, and community norms. What we've been up to We taught 2 babysitting classes in June, and I made like babysitting kits for them, which we filled with like parents lead activity books, playing cards, other branded materials. We had a large presence at our county fair with the parents lead marketed materials that I like put the promo logo on, like sunscreen, handheld fans, etc., etc. It was my first time using the radio advertising, and I was pleasantly surprised with the reach I was able to get. I chose to run those radio ads during the fair as well. So one promoted ND Tip, and then the other ad was just sober ride promotion. Obviously, with the fair being in Fessenden, most people live in other areas of the county. So obviously, like drinking at the beer gardens and then driving, making sure that there was a sober ride. Um, Continuing to collaborate with key stakeholders. We have monthly coalition meetings. It's like a behavioral health coalition. However, I feel like it's kind of headed in a weird direction probably for the last year or two. So I'm going to we're still going to have it, but I'm just refocusing for my grants and revitalizing a previously disbanded coalition that'll have like a more intimate focus on my grant work and have it be made up of like more community professionals like in the healthcare and service agencies and talking more about what they're seeing in their fields and just more common ground. Continue to have our billboard running, quarterly newsletters. We have a couple car seat checks coming up where we will have the parents lead materials and then gearing up for back to school and doing presentations to administration for our youth prevention curriculums. And then like I know I talked about at the SOAR meeting doing the keeping it real. Obviously with our struggles in Wells County with law enforcement, I solely teach that curriculum. It's just really hard to have consistent buy-in and a consistent presence to count on them to be able to implement it, especially to fidelity. So that's why I chose that like public health will just be the sole implementators of that program, and it's worked well. So these are some of like the branded materials. These are on the left is like a collapsible fan. So the circle part is just like a cloth material and then it folds into the plastic part. And then it has a lanyard string so like you can easily put it in your purse or around your neck like at the fair because it was kind of hot. And then the babysitting kits. And then in the back is like the sunscreen that I had made. And then that was just an example of bug spray, but we had it made in sanitizer and stuff as well. So that's kind of what I got and what I have been up to. Let me try and stop sharing. Okay, that's
Awesome. Thank you, Jordan. All right, we've got Foster County and First District left. Whoever wants to go first.
This is Robin in Foster. Oh,
go ahead.
Okay. This is Robin in Foster. I can go. I'll just share my screen just a second.
Okay.
Oh, get that right in. Okay, are you seeing my
Yes.
PowerPoint? Okay. Okay, so Foster County, we are working on underage drinking, and our intervening variable is community norms. Local condition, just to highlight as we do, high school students who have a perception of risk of harm that's been going in a negative direction. So less students reporting any degree of risk over time. So that's what's supporting us focusing on community norms and focusing on youth. The overall environmental change that we're working towards implementing a little P with an internal school policy change related to substance use to include some prevention language. There isn't any of that in there currently. So some of the big highlights or ways that we're working on that each year. In June, we have been able to meet with, we have 2 school districts in our county. So we've been able to meet with school administration and health teachers when they are available. Once the previous school year has wrapped up and graduation has been completed, so that we can review how the last school year worked in all of the different prevention programs and other ways that we support the schools. What went well, what didn't, what can we adjust going forward. Also a good chance to share additional resources, including this year shared a model policy with tobacco, a tobacco-free policy there. And then also plans for the next school year and hopefully expansion of prevention presence in the school districts. And this is, we bring lunch and it's an informal hour and a half or so conversation, and it's been pretty well received. This was my 3rd time going into the schools with our nurses and with public health. And so that's been a good chance to catch them before they're kind of in summer mode and before they're really busy with August and back to school. So both school districts are looking at implementing Catch My Breath a little bit more this next year, which is great. Also letting us come in for some professional development before school, talking about prevention, vaping prevention, naloxone, Credible Mind. We're planning to highlight that as well this year, next month. And then also our coalition, we have a Healthy Communities Coalition, being able to bring in that resource to them, and they're willing, one of the schools is willing to come in and have BCI come in with an internet safety presentation for parents. So we're really glad about that and hoping that we can implement that further with students and other ways as well. And a few other current activities to highlight. There was a mental health fair in May that we were a part of, and that's what one of the pictures there is, the booth that we had. That was a collaboration with the local hospital. They had some grant funding to support that, so that was a great event to kind of work on reducing stigma surrounding all things mental health related. Also been doing packets to local food pantry and local clinic, kind of reaching others that way. We had a big county fair booth as well as resources, and that was a big thing in June. And then working also with promoting and partnering with our coalition so that we can get the word out. Since COVID, the coalition has lost some momentum, and working on kind of reaching different sectors, different members, ages. I think we're really missing a key component with youth in there. So seeing how we can kind of revitalize the coalition there. And ours is more, I would say, of a mental health kind of overall focus as well. So how can we revisit that and make sure that we are having a good focus with substance use prevention. So a few other things up next. I'm looking forward to virtually attending the Montana Summer Institute next week, that conference. And I already mentioned looking at expanding our local coalition members and preparing for the upcoming school year and following up with schools on how we can support them and exploring ways to connect with teens, offering alcohol-free activities. Also our curriculums that we do have in the schools, how can we enhance and keep those current and up to date and really meet them where they're at. So yeah, lots of other events coming up this summer and staying busy. So thanks to everybody for sharing the ideas. And yesterday we had that was what the other picture was here. There was a teddy bear picnic that our coalition sponsored, which was kind of spearheaded by our city librarian, but it was a great chance to catch lots of daycares and lots of parents and lots of kids. So we used lots of parents lead materials there and got good word out about our coalition there too. So that is all I have. So thank you. Oh, I think you're on mute, Kelly.
I'm muted this time. Thank you. I appreciate it. Okay, finally we've got Jen with First District, and then we're done.
Just trying to share my screen.
I should have shared. I should share pictures in the chat. Tom did his forensic ID scanner training at First District yesterday, and then Jen had Georgie, was that her name? the gal who
Margie.
did Margie did the responsible beverage server training, and that all went really great. So maybe I'll pop a picture in the chat.
All right. I know you can see like the artwork, but I think for everyone's sake, let's just get moving, right? So yes, the training was wonderful. I was shocked and surprised, but we'll get to that at the end. Underage drinking, that's our target, our problem, our variable problem. High retail access, local conditions. Why am I not being able to click through that? Why am I doing this wrong? Oh, there it is. Sorry. 23 out of 25 are, oh, sorry. At that time, it was 23 out of 25. We're only utilizing the scanners. We're up to 6 and 7. It just bounces back and forth. I know I'm going through it fast. I'm sorry. Our strategy is that we are working with the city of Minot is doing an alcohol rewrite for their ordinance, and it was approved through the committee that it will be mandatory for RBS. Of course, it's not final until the city council approves the entire rewrite, which will be further down the line. But at this point, we've done what we can, and they have overwhelmingly approved it. So it will be not just for servers, it will be managers, it will be door people, it will be retail. So if you go into, let's say, a Cashwise food or a marketplace food to buy off sale, you'll have to have RBS. Yeah, so that's exciting and overwhelming. While talking about that, speaking of RBS, we will be having 2 more people certified during the August training. One is bilingual, so she will be helping target the Hispanic population that do not have English as a first language, so that's great. When it does come into effect, we will have to have many more trainings because a lot of people are not trained as of now. Speaking of RBS, Tom, like Kelly was just saying, was up yesterday to help do a training on forensic scanners for North Dakota State Fair. I was told a minimum of 15, and by the time everybody got there, there was 49. So luckily, I had some people, Kelly and Tom, who were able to help move tables quickly and try to open up a strange wall that comes out of the wall. But it went really well. Everybody was very engaged. I was amazed at, I was just watching all of the people, and most of them are not full-time servers. They are teachers. They're people who are just working for the fair. But they were just so into I was watching them with the fake IDs. Tom has lots of those that he passed out with the infrared lights, with all of it, and asking very good questions. I do feel like this year they are much more ready than they were the year before. So hopefully, we'll be able to keep some kids safe and keep the alcohol out of their hands at the fair. Lastly, with the fair, and this goes for all retailers in Minot. This has been in place for a year, the incentive program. Anytime a fake ID is captured, the instructions are to turn it over to law enforcement and then notify us that you did that. We call law enforcement, they verify, you get a $25 gift card. People were very excited about that last night, so I'm hoping that will help boost their desire to not just catch the fakes, but confiscate them. We did not partner, but we have been in contact with Ware County Sheriff's Department, notifying them of this, the scanners, all of it, so they won't be shocked when hopefully they turn over many IDs. So, am I missing anything, anyone? I don't think so. Questions?
I'm really excited to see if we get some fake IDs turned in this year. Because you were right. They were using the scanners last year, but they were afraid to confiscate the fake IDs. So
yes,
and they seemed excited about the reward for turning in the fake IDs. I think that's a good use of an incentive, for sure.
I hope you counted your IDs, Tom, because I don't want any of those being turned in for rewards.
That was a good thought. That would have been, I should do that. I'll turn in my own. Well, good work, you guys. You guys are all doing great work. So, good job. Is that all of them, Callie?
Yep, that's everything. So thank you very much, everybody. I know we went a little bit over, but it happens. As usual, I will be posting these. I know I haven't been sending out like the email updates letting you know that they're posted to the grantee websites, but I should have them posted hopefully within the next couple days. So just go to that grantee portal page, and then there should be a link to the YouTube video of these recordings. As usual, if there's anything else, feel free to email me, Tom, Tori, anything you guys need. But other than that, thank you guys very much and have a great rest of your week.
All right, good work, you guys. See ya.
Bye.